Nevada's first choice for news. This is 8 News Now at 4.
As we mentioned earlier, this flu season, there have already been 4 deaths in southern Nevada related to the virus. 2 of them were men over the age of 60. But just today, we found out about a child younger than 5 years old who died from the flu. Dr. Eileen Shi with Healthcare Partners joins us. Dr. Shi, how preventable were these deaths?
Well, I think they are definitely preventable because they are vaccine-protected illnesses. So that makes it extremely devastating, especially as a pediatrician, to hear about yet another death of a child under 5 years old.
Last year, we heard some complaints that last year's vaccine wasn't as effective as maybe many hoped it would be. What about this year's vaccine? Is it effective so far?
Well, the projection is that it's a good match. There's 2 different vaccines. There's a trivalent vaccine and there's a quadrivalent. And the trivalent and the quadrivalent, depending on which one you get, they both have strain A, 2 strains of strain A, the H1N1 and H3N2, and also at least one strain of influenza B.
Do you recommend to all your patients over the age of 6 months get that flu shot?
Absolutely. I tell all my families that if this were my child, and for myself, I would definitely get the vaccine.
Let me ask you, as a parent, I have 2 sick kids at home. I think they have a cold. How do I know for sure that they don't have the flu? What are the signs? What are the differences between a cold and a flu?
That's a great question. I'm glad you asked, because often when you're looking at your child, the flu usually comes on pretty suddenly. Your child will show some muscle aches. There's always a fever that's pretty severe, and there's also some signs of runny nose and stomach upsets and fatigue.
Is there any point my sick kids at home, is there any point, whether it be a temperature, certain temperature or fever or discomfort, that I say, okay, I have to take my child into the ER?
Yes, I say, there's probably not exact number that you would go by, but as a parent, you would want to see, when is your child really acting out of the norm? Is your child not able to drink any water? Is she looking more tired than always? Is she not responding to you as she normally would? And she just haven't been eating, haven't been going to the bathroom all day? And those would be things that I will watch out for.
So this has been a deadly flu season. It's going to get deadlier. There were 26 flu-related deaths in last year's flu season. I have to ask you, doctor, I've always wondered this. How do doctors who meet with sick people all week long keep from getting sick?
Well, personally, I get the vaccine every year as a protection against myself. And for all these years of practice, I've never been sick. And every flu season, we do see a lot of patients with the flu. And we are starting to see just the beginning of the flu season. And usually flu season hits us in January and February, and it goes all the way through May. So it's definitely not the time now to get the vaccine.
How many times a day are you washing your hands? What would you recommend?
Every time, with every contact with a patient, I will wash my hand after.
Every single time. And do you take the time to suggest to people who come into your office who are sick, hey, you're ill and you have the germs, don't spread them. Wash your hands and cough or sneeze into your sleeve. Do you go that far as to do that?
To some patients I do. As the old saying goes, you want to always cover your cough with the sleeves of your arms and also wash your hands as much as you can. Dr.
Eileen Shi, thank you so much for joining us. It is cold in flu season. It's cold out there. Let's find out more about the weather with Ted.
Hey, Paul and Denise, by the way, Shea Swinsk has some hand sanitizer up there if you really need to use it. Outside.